joining us, the next to the 10-year health plan. We're joined by Penny, who's our newly elected chair of the CCIO group, Hayley, our new elected chair of the CNIO group, James, who's the deputy chair of the CIO group, John, who's the chair of the ICS Council, and Ben, who's the chair of our CSO Council. And John, of course, is the chair of the Digital Health Networks, who's going to be chairing the discussion today for you. I'll let you introduce yourself, but I'll pass it over to you, John. Thanks, everyone.
Yeah, welcome everyone. Welcome to this Digital Health Networks special. As I'm sure everyone's aware, unless they've been living in a cave, the 10-year plan for health was published end of last week. There's been an absolute kind of flurry of articles, podcasts, news coverage of it. And delighted to kind of welcome the chairs of the networks to really kind of begin to kind of dig down a bit further and talk about the plan. It's got an awful lot of kind of digital kind of aspiration in there. This is a interactive kind of webinar, so we will be asking people joining to post their questions in the Q&A. Q&A is on your screen. But first off, I just wanted to kind of go around the panel and ask people what they thought, what was their overall first impression of the plan. A lot in there. We were just talking about kind of having to kind of dig deep to kind of really kind of unpack it, and AI summaries alone not kind of doing it justice. So let's go around and ask each of our kind of panelists what was their overall impression of the plan. Hayley, perhaps you go first.
Thank you, John. Yeah, I think for me, I was quite encouraged by the plan. I think at last, as you kind of alluded to, digital and data is front and centre, and actually not only one of the main shifts. I think it encompasses, you know, it's the golden thread through each of the shifts. And I think those shifts won't happen without digital. But for me, the real standout, I think, was how patient-centric it was and how people-centric. So I was actually part of the people work stream, so really encouraged to see how much people are at the centre of it. So firstly patients, but also staff. But coming back to the patient bit, you know, the choice, the control, absolutely intrigued by the idea of patient power payments. So actually giving the power to patients and bringing patient experience back to the centre of all we do, I found really encouraging.
Thanks, Hayley. And I'm intrigued, as someone who was one of the working groups on the people working group, how much did the work that your kind of group did translate into the final report? Was it did you recognise it?
It's really interesting because actually we saw a final report that was then sent in and we heard no more until it was published. So I was so eager to look at it, and actually reassuringly a lot of it did. I'm actually doing a session at summer schools and I'm actually going to reflect on the recommendations I personally made and how they've been drawn out. So yes, a lot of it has, but I think also a lot of it seems like it may have, the detail shifted into the upcoming workforce plan. So I think a lot of it has been alluded to, the details missing. I'm hoping it's in the follow-up.
Great, thanks, Hayley. Next up, let's call on John Mitchell. John is chair of the ICS Digital Council, and John, although the kind of nomenclature has changed, huge focus on neighbourhood kind of as the focus for delivery. Yeah, what were your first impressions?
Yeah, thanks, John. Hi, everyone. So I think for me, going through and recognizing some of the concepts which we're already working on was really quite positive, whether it be putting the NHS app as a front door. And you know, primary care has been kind of trying to push that for quite some time with some functionality, through to linking up neighbourhood providers through a single system. Well, some of us have been trying to do that and actively doing that for several years as well. A lot of the concepts aren't new, it just turns up the dial. And so that gives us an opportunity to not reinvent all the wheel, but to build on some of the established benefits and plans that are already in place and really push on with those. I think, you know, by refocusing around the patient rather than the professional is really welcome. by putting the patient and empowering them to be able to manage their own healthcare and their own health process is a really good positive step forward. Now, clearly, we need to make sure that we don't exclude anybody from those processes, but I think there's a lot in the plan which really steps us in the right direction for a fit for future health service.
Thanks, John. Moving swiftly along, welcome to Penny. Penny, congrats on being elected our first female chair of the CCIO network. What were your kind of thoughts on the plan?
Thank you, John. I hope you can all hear me. Yes?
Yes.
Excellent. And thank you I'm delighted to be the first female chair of the CCIO panel. And for me, the plan is an ambitious plan, first of all, but it's pleasant to see how neighborhood health is described and enabled through digital and data. I think this is very, very important. And we talked about a single health record for quite some time, and having the NHS app where patients will be able to view providers, have choice, use it for self-management, for chronic illness, but also for access to acute care. So this is all very, very positive and a positive movement forward. I would say, given how ambitious it is to be implemented hand in hand with a new quality report that Penny Das has produced, because it's important not to overlook on quality, but also it's important that we look at it in the wider infrastructure to make sure that we've got the basics and that we are able to implement that ambitious plan moving forward.
Thanks, Penny. James Hawkins. James, you're a seasoned kind of vet. You've seen a few plans over the years. What do you think of this one?
I have. Thanks, John, and good morning, everybody. Yeah, so firstly, I thought it was hugely ambitious, very visionary. I was thinking back, as you say, my seasoned career, back to the long-term plan in 2019, where there was a big debate whether we'd have a digital chapter or not, and therefore having a whole one of the 3 shifts all around digital, and as Hayley said, that digital underpins the other parts of the plan, is really, really encouraging. And we are front and centre of that plan. I think the 3 main things that stood out was the digital, patient-centric, and obviously we need to be financially stable. Those were the 3 things that I sort of took from it. There's a few old favourites in the plan, so I really welcome the continued push, as John said, to continue to empower patients to take control over their health, to take over the transactional aspects of their healthcare. I smiled when there was a reappearance of the Health Store version 3 in there. I think, again, with huge continued ambition about health data for research. A few surprises in there. I think I was surprised around the commitment to do a national procurement for a community platform, which I'm absolutely an advocate of doing things once where it makes financial and economic sense and where it fits, but that was a surprise. Huge ambition about a doctor in your pocket. We've obviously followed the stories of other commercially provided doctors in your pockets over the years, so we'll watch that one with interest. And obviously, as Penny said, the commitment to a single patient record is a hugely ambitious. We've obviously tried various things like that before, and it's really important that we get agreed scope, purpose of that record. We think carefully about patient consent, political commitment will need to be strong, and really think about how that record integrates with the current infrastructure and the sort of investment required to do that. So yeah, really, really pleased that we are sort of at last front and centre and everyone's talking about digital. It's taken quite a while.
Thanks, James. And also congrats to you on being elected Vice Chair of the CIO Network. That's excellent news. And last, absolutely not least, is Ben Jeeves, who is joining us, one of the kind of leaders of the CSO Network, Clinical Safety Officer Network. Ben, what were your thoughts on the first impressions on the plan?
I share the thoughts of the group here today. Ambitious, but I take that as quite invigorating. I think if we look back to the events that unfolded around Rewired, there was a lot of energy that came out of the back of that. So we were seeing an awful lot of challenge and pressure, and no end of people are living that at the minute. So for me, I think it brought a degree of invigoration, ambition, yes, but again, I think that sets the drive and the pace and the tempo which we can deliver. There's a whole raft of things that need to come with it, and we've touched on workforce. Finances are in that, because they are fundamental to being able to achieve that. But again, we've heard reassurances around that. Ultimately, that comes down to whether those get delivered enough. But for me, absolutely empowered. And again, digital is front and foremost. We are absolutely a biased audience here, I think, in terms of we absolutely understand what digital can deliver for the benefits of clinical users and patients alike. So for me, absolutely invigorated. And again, the fact that there are some real specifics in there to run with, I think that absolutely is the way forward. The question, yes, is in the how, but I think for me, definitely it's energy, and I think it was something that very much is welcomed given the recent pressures.
Thanks, Ben. I think that's my phrase so far of the webinar, is an invigorating amount of digital, which takes us on quite nicely to the next question, which is, and for this one, I think I'm going to ask the panel to use the raise hand, and I'll take them in the order that people kind of raise their hand. So what do you think of the digital ambition set out? And there is an awful lot of digital ambition. Almost on every page, there are digital big and small. So I think, again, this is big picture, but overall, what did you think about the digital ambitions? And what were the things that really kind of, on the digital data side of things, stood out for you? Who'd like to go first? Hayley, thanks for being brave and volunteering first.
I thought I'd talk to you again a little bit around the people bit. So I felt like during the consultation, I was sometimes, not always, and the group were fantastic that I worked with, but sometimes a lone voice in the upskilling of staff to take on the technology. I think all of us that have been involved in any sort of digital delivery, we know it's the people that make the difference, and them having the skills and knowledge and a desire to make the change can make all the difference. So I think while it's definitely alluded to, and like we've talked about, there's talk of digital and data skills being embedded in postgraduate, in undergraduate training. Again, there's little detail about the how and actually how we'll enact that, and what skills, what does that actually mean? So I feel like that's a little bit missing and absolutely needs to be a driver. And one of my key recommendations was actually, yes, for our undergraduates, but actually, are our leaders equipped to move at the pace that this ambitious plan is wanting us to? So actually, are our leaders, which are not possibly digitally native, are they ready to lead in a, what do they call it in the plan, digital by default, NHS? So I think there's definitely something, and again, it was kind of mentioned, and maybe it's a lot of things throughout the plan, the detail, maybe it will come with the workforce plan, but certainly what can we do to help our current leaders, the leaders coming behind them, our digital leaders, to actually really, I guess, get the skills, get the knowledge, get the confidence to be able to drive forward all the digital that's kind of laced within the plan. And I guess some of it I found a little bit contradictory. So we're saying that we need to skill everyone, and yet the places on the NHS Digital Academy have been cut, I think, by nearly half this year. So I think there's something's amiss in terms of how we're preparing our people. But I'm hoping there's a big follow-up to that.
And I know we're probably promised a people plan to follow, Hayley, but was there any mention of a digital workforce kind of plan, which is
interesting, not specifically? And I guess one of my reflections was that I didn't feel like we were being ambitious enough, and there was lots of, because we were part of the people work group, it was already obviously very much focused on looking after our people and making the NHS somewhere we really want people to work again and love working for, and retain that loyalty, which is completely correct. But actually there was something around, for me, missing that. Actually, what can we get technology to do to move our people into better jobs, so let's get rid of the monotony of some jobs and actually make people what they're delivering for the NHS much more interesting. So there was a reluctance, I think, to even imagine that technology could take over some jobs in the NHS. So I think, that bit we probably need to flesh out a little bit as well.
Thanks, Hayley. Next up, Penny.
Thank you. And I think Hayley said it very nicely that digital leadership is paramount here. And I've spoken a lot about digital leadership before, and it comes, top down and bottom up. I think our senior leaders need, first of all, to appreciate and understand what
Or Penny, I think you've frozen. I know Penny's in Italy, was having some Wi-Fi problems. So let's come back to Penny, if that's okay. Ben, you were next.
Yeah, thank you. It follows on from your points, Hayley, around people, and that alludes to my point earlier. It's in the how. And again, that digital leadership, we absolutely need that. And again, going back to the spring and the challenges that we're living now around workforce pressures, particularly at a digital level. I'm aware of so many digital teams having to actually reduce their headcount, which is slowing down transformation. We haven't, and again, particularly from the CSO lens, really having to advocate the role of the CSO and its importance in deploying these things. So again, coming from a biased perspective around ambient AI, that's particularly key to my role and how central that is. Absolutely, that has got all of the potential to be hugely transformational, not just from an efficiency point of view, but completely rewriting how we live our clinics and how much a patient feels listened to. And it's that quality of care. We can drive quality. It's not just the metrics around numbers, patients seen and waiting lists. I think absolutely that is a tool to reach a number of benefit measures. But if we haven't got the digital workforce, the digital leadership, the training team to follow that up in its entirety, we won't realise the benefits from it. We know that a tool can be absolutely fantastic, but it's not delivered. Clinicians will not feel it's doing what it is that they want to do because there's a whole package of stuff that needs to be wrapped around it. So for me, whilst absolutely invigorated by the plan that it's specifically mentioned in ambient AI, it's all of the stuff that's got to go with it for me. And we're living that. We're at the trough of that inverted U at the minute, aren't we, around the financial pressures, workforce that's unfortunately is being lost. So for me, very quickly, that needs to be addressed because that sort of tech is what we can actually deliver now. That isn't in 5 years or 8 years, but the risk is that's where we'll be on the plan for that particular tech if we don't address the reality of some of the challenges we've got right now. So invigorating, yes, but again, a dose of reality is we've got to look at where we are and how do we get to a much stronger place, hopefully as quickly as possible.
Thanks, Ben. Penny joined us quick as a flash. You switched, I think, to a mobile phone. Penny, good to have you back.
Thank you. Let me just continue. I spoke about education for our digital leaders. My next point is around neighborhood health, and achieving the single patient records is also about digital literacy for our citizens and patients, because what we don't want is to move forward faster than our people and our population can actually move. And how do we bring the patient voice in as well as the clinical voice to co-design those solutions moving forward?
Thanks, Penny. And next up was John, then James.
Thanks, John. Just a quick point on the ambition of the overall document. When you start reading the document, it's quite scathing around the current digital maturity of health providers. It basically says that the rest of the world has moved on and we haven't. And it's not only just good enough to catch up, but actually we need to get to the point where we are the world leader. So in terms of ambition, if we try and put that into real life examples, at the moment, if people need to see a GP, then actually they need to try and get on the phone for anywhere between 10 and 40 minutes in order to make an appointment, and then somebody might call them back either that day or sometime in the next week. To the ambition where we've got a virtual doctor in the pocket within 10 years who can really pick up some of that key important initial contact with patients and make sure that they end up in the right place first time. and get the help that they need. So in terms of analog to digital, it's not just about the kit, but it's very much around moving away from analog processes as well, making sure that they're empowered, making sure that tech's there, and really making sure that we are able to offer that point of care virtually where possible, so that everyone gets the best possible benefit out of that. And that's a pretty strong ambition when you kind of put it back into patient real world experiences. We just need to make sure that we don't leave anybody behind, either the public or our staff. But in terms of ambition, it's really good. It's really strong.
Thanks, John. And James.
Yeah, just picking up on the ambition. Obviously, we've heard already the plan is extremely ambitious, and there's loads of commitments. And picking up on Ben's point, currently we are suffering in provider land from the challenge around increasing corporate spend and the reduction of 50%, etc. So unless the whole system makes that move from technology as a back office corporate function to be a central enabler of NHS's core mission, then we will not have the funding or the alignment to be able to deliver the plan. And therefore, that needs to be continued to be front and centre of everybody across the NHS, that technology is an enabler of care. I think the unfortunate news last week of the death of a patient due to the Sonova cyber attack, however unfortunate it is, it does help focus the mind on the wider non-digital executives and staff to realise how important this stuff is and how safety critical it is. Somebody mentioned earlier that the plan is contradictory in some parts. There are a few contradictions in there. I was just going to pick out one, just around the legal complexity of some of the asks. I mean, this plan is hugely complex. It's going to be hugely political, and it's going to be really challenging to deliver everything that's outlined. And what you mentioned, data, John. There's a commitment to changing legislation around enabling data to be used for research, but there's also a commitment around genomics data to be absolutely held by the patient and not to be shared without explicit consent of the patient. The two don't really always align in my mind. So I think there needs to be really some thinking, a step back and looking at the overall plan and just think about how it should be sort of managed in terms of the dependencies and what needs to come first. But hugely ambitious and hugely complex.
Thanks, James. I'm just going to bring in a few of the kind of comments that have been coming in chat. And apologies, the Q&A wasn't switched on. Anyway, lots of good responses coming in. A real kind of clutch of them around training and skills, workforce. So Odita Natasha says, what new plans or opportunities training will be available to update, train, prepare staff to support the digital ambitions, particularly concerning kind of AI? Molly Sabola says, we have to ensure the current workforce is skilled up to digital literacy, and that's massively improved. And then a few also around kind of staffing, but talking about, rather jarring, given that the kind of reality that many organizations are facing are significant job cuts currently, including in digital teams. So I think we'll come back to that, but I just wanted to bring in a few comments there. What I wanted to ask next of the panel is pick out one thing that has a kind of digital kind of at its core that really excited you in the plan. So I'm hoping here we've got a range of things that people are excited by, but can I kind of ask the panelists to kind of pick out one thing, say why excited them, and let's see kind of what we get coming. We haven't prepared this bit in advance for those joining us, so I'm intrigued by what the responses are. Again, if we could use raised hands to go order. Ben, he's
straight in, absolutely. I mean, again, biased position, but for me, absolutely, it's the ambient AI. I think absolutely the potential for that is enormous. So being at the sharp end of that, for me, absolutely brings that excitement. And the other bit that is mentioned, again, you could argue perhaps not enough, but it's there for me. It's around partnership, and that's partnership at multiple levels. And it talks about industry partnership, because absolutely that's how these things get delivered. It's about working together. It isn't just this, buy this thing, switch it on, it's going to work. It's around that co-design. There was a comment around kind of patient and staff pathways. So again, for me, it's all the fundamentals. It's your project management, it's your benefits management approach. Do your process mapping, measure it. You know, if it's important, measure it, get some metric against it, see what that change is. Then you can look to where, well, that hasn't quite delivered what we expected quite so much in that area. Does that need more focus, or should you deploy something or scale something in a slightly different area? Again, these things are never a one size fits all. There might be a particular specialty that absolutely you want to drill down into. And for me, this isn't always about deploying something as wide as possible. It's about doing it as well as possible, because then you've got a really good baseline to build everything from there. So for me, the fundamentals around the specific bits of tech, but the partnership bit for me, absolutely, because it's always comes back down to people.
Thanks, Ben. I noticed that one of the things that the plan has is it kind of breathes life back into PFI, the name of public-private partnerships, which I think is a whole nother kind of webinar, but lots of interesting stuff about kind of partnership there, digital as well. Okay, next up, we have James.
So a bit of repetition. I think the thing that excites me most is this profound shift from technology being a back office corporate function to being absolutely central to the NHS's core mission. So that's the fundamental excitement thing. Also, the increased investment in digital from the spending review that's also mentioned in the plan. I think that is a huge signal we need to work through with national colleagues of how we spend that money wisely for the benefit of the patients. And then thirdly, a bit like Jeeves, as a provider CDIO, AI and ambient AI, or any AI that can increase productivity and release cash release and benefits to reinvest in transformation, that's the most sort of most exciting thing for me, given the significant challenges around funding that we currently face. I think that can be a real game changer in terms of releasing cash to continue to transform.
Thanks, James. Hayley.
Unsurprisingly, I think the patient-facing technology. So I think a real commitment to give patients access to their healthcare records, their healthcare appointments, managing their healthcare, doctor in your pocket, you know, all of that stuff. Having worked with a few different portals, it really is transformational, and the bit that I probably enjoyed most in the number of implementations I've been part of. And I think yeah, so really excited by all of those concepts. I guess again, a little bit missing around to John's point, how are we taking all of our patients along with us? We've got really good data out there now from patients that do and don't engage with these kinds of things. So actually, what are we going to do about it to make sure that no patient's left behind and no patient's disadvantaged by not being part of it? So how are we going to mitigate any risks of patients not wanting to book their appointments online, or not wanting to receive their blood results via their app? How are we going to make sure that they can equally manage their health conditions effectively? But yeah, I think for me that's where the real power comes, not just for me as somebody that works in NHS, a nurse, and somebody that's delivering the stuff, but actually the patient. It's gonna be great. Like my experience as a patient currently with my healthcare and my GP and is not great digitally. In fact, I wanted to drop them in a business card to I'll see if they need any help, because the way they've shifted hasn't been the best patient experience. So I think done right, it can be truly transformational.
And on the NHS app in particular, as part of that, Hayley, NHS app obviously kind of not new, but wow, they've doubled, quadrupled down on ambition on the NHS app. So great to see the ambition, but a lot of digital eggs in that basket, if I can horribly mix metaphors.
Yes, absolutely. And I think and for me, that's part of the excitement of this ambition, is to bring it all together. So certainly, you know, you work in different organizations, they have different apps. As a patient going between different organizations, and patients quite often assume that the NHS is one entity, and then so, you know, it's hugely frustrating when they're being cared for in 2 different specialist hospitals and they have to go between 2 different apps, and likely have their bloods done again, you know, the next day at the next hospital, all of those sorts of things, which, you know, all of that, if we're able to get it all in one place and usable by not just the patient, but potentially the various healthcare professionals in the neighbourhood care model, you know, it has the potential to completely change the way patients experience healthcare.
Thanks, Hayley. Penny.
Yes, for me, what excites me is that it's not just an extension of deployment of technology here, it's the whole changing of the operating model in the NHS. We need to look at it as a whole system change approach of the pathways and actually redesign those pathways quite quickly with patients and end users in mind, so that we actually add value. And that value, what could that look like? Is it about productivity? Is it about patient experience? Is it about long-term outcomes, or all of those things? But what we shouldn't miss doing is actually, as we're implementing this change and new model, is actually evaluating and measuring that value. And that requires quite a lot of work and quite a lot of going back to basics and making sure that the basic IT works before we expand into a sickly record.
Thank you, Penny. A really important point. I think that's really helpful to kind of bring that in. John.
Yeah, thanks, John. For me, the most exciting thing is the use of the word "my." So the word "my" appears in the document 94 times. So things like my specialist tool, my consult, my care, my vaccinations, my companion, my carer, my choices. It really does set out a really strong, exciting ambition. At the moment, we're in a place where even if you're digitally mature or digitally literate as a patient, there are too many times when the computer says no, because either something hasn't been turned on or somebody has overwritten your preferences for access. This really is kind of putting the patient back. So kind of that word "my" is kind of really exciting. Even at the moment, with our limited take-up across Humber, North Yorkshire, we have over 200,000 repeat prescriptions managed every month, which equates to about 65,000 hours of patient time saved a month across our patch. Now imagine if we turn that dial up. So rather than it being an add-on to access the service, it becomes the true core, the true front door, and that true enabler. At that point, the benefits everyone will be absolutely fantastic. So for me, it's absolutely about that word "my."
So that focus on the patient, which "my" denotes throughout, John, that's what you're saying.
Absolutely. We have to be an NHS for our population, not a population for the NHS.
Okay. Question for you all. The kind of, I know part of the kind of art of these types of kind of documents is to kind of embed ideas and convey ideas kind of very strongly. And to achieve that, there's always a bit of kind of oversimplification and painting things in kind of very stark black and white terms. But do you think the plan overdoes that in talking about a shift from analog to digital? The NHS obviously is not analog. It's got lots of digital, lots of analog, and it's a bit of a proverbial curate's egg. But throughout the kind of plan, there is a bit of a kind of underlying kind of message, which is the NHS is a bit of a basket case on digital right now, and it's only by moving to this new vision that can be overcome. And I suppose that's epitomized on the single patient kind of record and the ambition that's associated around that. And there's certainly suggestions in places that SPR will replace current EPRs at some point in the future. So what I'm saying is there enough recognition of the digital achievements which are widespread across the NHS already? Anyone like to come back? Hey.
This is the point that I've not argued, but I guess has been a bit of a sticking point since the Darzi reviews. My first reflection on that was, are we really analog? The amount of effort and time and years that many of us have spent into shifting to digital, it did feel a little bit unfair and maybe not reflective of everywhere. So I think while, but then, you know, I had another reflection. I thought, well, actually, I guess it's about having us all level up, isn't it? To get to somewhere where we are not relying on disparate systems. And actually, while, you know, even in my own trust now, we've got amazing digital systems that work well, but actually they are, you know, partnered with a very manual paper process because we haven't quite shifted completely. So so I've kind of changed my thinking slightly on that. But so yeah, so like the ethos around it. But yeah, I think there probably it's spattered in there, isn't it, in terms of what we've managed to achieve and the bits that we can build on. But I certainly think we do need to pull out probably more around the delivery plan as to exactly which bits are working really well. You know, we've got blueprints, we've got guidance, we've got lots of lessons learned from things gone forward, and actually that could probably be pulled out in whatever is to follow, to let us know this is actually what's worked, this is what you can mirror now, and this is how we can move forward.
And I think just to kind of expand on that a little bit, kind of, Hayley, one of my kind of thoughts when reading the plan was that you've got to deliver this, and you know, the NHS is very brownfield foundations. There's a bit of everything out there, and and again, I think we all recognise that this is trying to convey a vision, but it's a very greenfield, sunlit uplands that doesn't bear an awful lot of resemblance to the kind of things that people are sharing in chat about where they are right now. Ben, if I could bring you in next.
Yeah, much the same, really. Again, there are certainly really great examples of fantastic digital maturity. But again, I think if we look at it across the landscape and then we consider it from a system view as well, those pockets are not necessarily helping things that are sitting geographically quite close. So again, I think it is right. It does paint a picture of reality. That might not be the exact reality for everybody, but I do think we need to consider what's the lowest starting point as to where we are, because that's the point that we need to bring up. There is that need for levelling up, but at the same time, those places that are in a good position, they absolutely keep driving it forwards. You know, they are the benchmark. They are then therefore helping to support those that aren't in as a digitally mature position. So levelling up, absolutely, but at the same time, really keeping up that pace of innovation and transformation as well for me.
Thanks, Ben. James.
So my background is I was a Master of Engineering in electronic and electrical engineering, and when the soundbite came out from analog to digital, it did make me think, oh my gosh, they don't even know what they're talking about. But I've got over that, and I'm just, they couldn't use paper to digital because it would have reminded them of paperless 2020 or whatever it was. So I'm quite content with the analog to digital tagline, and I'm also not too worried about painting a really bad picture of where we are now. It helps create the case for investment. But the reality is we have, you know, it's difficult to deliver stuff. We have made huge strides over the last 20, 30 years in digital. We've got some great things that we should be proud about, both nationally and locally and regionally. So I'm quite comfortable. And I, as I said many times on this call, you know, it's an absolute fantastic position to be, that now we are positioned at heart of, you know, the new core of what the NHS wants to achieve. So I'm comfortable with it, John.
Okay, good. Thanks, James. Penny.
For me, I think that there has been a tremendous piece of work over the last few years to improve digital maturity in organizations and systems, and we need to recognize that. And as Hayley said, there are blueprints out there, there are best practice guidance out there. I think what we are not yet achieved is interoperability, how we ensure connectivity. And if we are to say that, you know, patients will have all the information will be in a single record, that requires really partnerships, and it requires a lot of effort to actually connect everything together, which at the moment a patient goes out of a system receiving care in another system and they're not able to access their medical records. And we need really to get to the point where patients can access care and access their record anywhere. So I think that is what we need to work on. And of course, there are areas that have advance more in their digital maturity? How do we learn as systems to ensure that we don't reinvent the wheel, but we learn from good practice, scale good practice?
Thanks, Penny. John.
Yeah, thanks. I quite like the term analog to digital. After we stopped thinking about it, just talking about digital systems and wires and cables, there's been lots of good work around putting in digital solutions, IT systems, but generally around individual organizations, not necessarily around the whole pathway. So until we start looking at analog to digital pathways, then actually there's always going to be a gap. Each time we need someone to do something outside of their normal working environment, it adds overhead and it adds risk. So each time, for example, somebody needs to copy something into an email or needs to log into a second or third system to be able to access information or forward information, or even with some of the latest ambient AI tools, the fact that it still needs a manual analog copy and paste process in order to get the information out of the AI ambient tool into a coded system, there's still work for us to do. So in my mindset, analog to digital isn't around the individual systems. Loads of people have done some really good work on that. It's the overall pathway, the overall process. That's how do we automate, how do we make safe, how do we further increase our productivity? How do we encase everything into a single workflow?
Thank you. I mean, a big part of the kind of plan is about having devolution, about local decision making, kind of at the neighbourhood level, to reflect the kind of needs of populations. And yet, on digital, the balance and part of the challenge has always been, what do you need to do nationally? It does seem in this plan that key decisions on platforms are taken at the national level for federated data platform, single patient record, NHS Act. I think there's also kind of news of a new national procurement for virtual wards, and I think a suggestion as well for single sign-on, that's a little bit kind of definite. Is that an appropriate level of decision making on stuff that's being decided nationally before we've even set up these kind of neighbourhood and more local structures? So the question really is about digital. How much should strategy be based on local understanding of context? John, I know this is kind of right in your kind of ballpark. I'm going to put that one to you first of all.
Yeah, it's a thin line, isn't it, John? So how much do you concentrate your strategies around the individual needs of your population, of which each population will have significantly different needs, and therefore it's easy to say you can't have one size fits all, against sharing good practice, sharing shared procurement, sharing value at scale, efficiency at scale, in order to remove some of the overheads that perhaps I've just criticised. It's really interesting. I think for me, the subject matter experts around their areas, the people who are based at place or at neighbourhoods. They know their patients, they know their requirements, they know the environment in which they live. There has to be some ability for those local subject matter experts to tailor the national offerings, the national solutions, as well as being able to say, well, actually, we've got a specific need here, and we need to find something which is unique to us, which will also plug this gap in order to get the best solution for our patient populations overall. What I'm not sure yet is I'm not sure whether we understand from the 10-year plan exactly all the detail which will allow us to be able to start facilitate that. Clearly, there's some really strong national digital solutions on the way. James mentioned one earlier around the community solution, but also it does talk about moving away from Whitehall, moving away from Central, and putting some of that empowerment back into neighbourhoods. So I think there's reason to be optimistic. If we can get the best of both worlds, so we get access to all the efficiency at scale, but still keeping some of that local ownership where it really matters, where it offers the highest possible value, and we can do that without introducing too much overhead, then I think we'll be onto a winner. You know, systems understand systems. Okay, so we kind of need to understand that, John.
Thanks, John. I'm going to start bringing others in on this one. James.
Yes, specifically on the question, I mean, I am a strong advocate of doing things once where it makes economic, technical sense to do so, and I fully support, scaling up, for example, the national NHS app to take on more in a market of helping the market to innovate and do even better things. So I fully support that. As I said earlier, I was surprised by the statement around a nationally procured community stroke virtual ward solution or community solution for neighbourhoods. And that was one of the contradictions in the report or the plan, that there is a push to move to what I refer to accountable care organisations, but I know there's a new term. So my view of them would be to spread, from a technology point of view, maybe spread the EPRs to include more of the neighbourhood, access to council, and spread out that way, and use local EPRs in a wider footprint. But a nationally procured community system just frightens me to death of more interoperability challenges, which would mean more investment, more priorities, and that's one of the sort of contradictions I can't get my head around. If it was a piece of disruption that we will go towards a central care service for virtual care, then that may make sense, but it's not clear from the report. And in terms of engagement, I think with this plan and taking it forward, I think there is much better engagement between the national team and the local and regional teams. There's much better engagement than there probably has ever been in terms of a sense of a one digital team. So I would continue to advocate for using the CDIOs, using the CNOs, CCIOs, CSOs, and co-create something that's going to work for everybody going forward. So working open and let us contribute would be my advice.
Thanks, James. Ben and then Penny.
To follow up on all of those points, really, again, it's partnership, it's co-creation, and as John has said, there is a fine line, and it's much the same as where tech is an enabler at a provider level. This is where policy and finances absolutely should be an enabler at a more system-wide approach. If you've got that local intel as to what specifics you need, which is different from, a place that's many, many miles away, it's how that's enabled. If we can get to a position where a number of things are centralized and that is then mapped out across, again, there's so much duplication that can be reduced, and just that in itself, supporting a particular project or a particular system that actually is being deployed nationally, albeit at different timelines, that can free up resource. That will enable more transformation, because again, that can be redirected. So we can get to a place where if we take a bit more of a structured approach and a far more national approach to these things, we can actually start to accelerate the transformation by removing some of the barriers. So I absolutely advocate clinical safety, but I know, again, we're getting little pockets where people are doing it together, which is helping. But what we need is massive scale for that. How can we do that more regionally, even nationally, rather than just two local trusts doing the same thing? That's still got a benefit. But again, that's a winner. That's a proven solid approach. Let's scale that approach so we can redirect the resource. So again, this is about really being brave. I think it's scaling those efficiency benefits, just that one step detached maybe, but again, it's got huge potential. So I'd like to see a lot more coming out of the centre to enable that to happen far more, really.
Thanks, Ben. Penny.
Yeah, I mean, like the others, I'm very much pro what John said about finding that balance. I mean, I completely understand about the centrally scaled solution to achieve economies of scale, but at the same time, we need to give neighborhoods the autonomy to make some decisions around their populations. Because again, not forget, if we try to scale solution in some areas too fast, then we might risk excluding vital population cohorts, and we may not achieve value out of that. So again, Ben talked about regional teams, and I think leadership here, digital health leadership, is really important at a neighborhood and regional level in guiding those nuances that particular neighborhoods and regions have to that bigger solution.
Thanks, Penny, and Hayley.
So I think for me, it's about understanding the problem. So we have this tendency in digital to try and fit technology into what we think is a problem, or we get people coming to us with the solutions before we've understood the problem. So I think what is the problem we're trying to solve? Is it that we want to have a system that patients can be treated anywhere, beyond the walls of any one organisation or any local region, in which case that maybe a national system is the answer? Or is it that actually we want them to be focused locally, but we need the interoperability, that if they did need healthcare on their holiday or whatever, then that can satisfy that. And then once we fully understand our problem, I think that's where we push to suppliers. So I completely agree with everything John and Penny said around that, finding the balance. So actually, what can the technology deliver for us then in that realm? So is it one platform that can be customized to local areas, or actually is it a number of different systems that then have to talk to each other in an intelligent way? So yes, I think again it's about coming back to what problem are we trying to solve, and then working with our system and supplier partners to fulfill that, rather than trying to mold something that might already exist into what we think is a solution.
Okay, we're going to come on to what do you think is needed next to actually implement this. Clearly, people have been touching on that. I'm just going to pull out a couple of the comments from chat, and some great comments there, folks. I'm sorry we're not going to get to all of them. Graham Allen from NHS Northern England says, lift financial restrictions. We still have the crazy situation with budgets underspent at end of year. Projects, programs not being able to accrue is a real issue. Next comment was from Simon Wilson, that says the money has to flow and flow quickly. Approvals are still far too bureaucratic. The perennial problem about CapEx and OpEx. And he says, personally, I'd like to see the shackles removed in the same ways that it was during the early stages of COVID. So as we move from something which is long on vision and short on kind of detail of how to deliver, how would you, as digital leaders in key parts of the NHS with a lot of experience of what's involved in actually successfully kind of delivering big complex kind of programs, what do you believe are the essential kind of next steps that begin to translate this vision into something which is more deliverable? And if I just throw one more kind of element to that, a lot of people have kind of highlighted that the system's obviously already under stress and a huge amount of organizational change. NHSE, DHSC, cuts and mergers of ICBs. This is not an environment that is going to make it any easier to implement into. So as a digital leader, what are the steps that you think are needed next to give us the best chance of success of the 10-year plan's digital aspirations? Nice, simple one. James, I can see you're chewing to kind of get into that one. Yeah? John's beat you to it. Let's go to John first. And John, by the way, a comment just for you. Someone says that John Mitchell's talking a lot of sense. I thought I'd better pull that one out for you.
I try. So one of the challenges that we have at the moment, and it could be the biggest blocker to us going forward, is the sheer number of silos across the organisations for which we worked for. And it doesn't matter which part of the organisation, across, whether it be very place organisation, right up to national. There are a lot of silos that just get in the way. Okay, in order to deliver the level of ambition that's outlined across the next 10 years, we have to consider ourselves to be part of the same solution, part of the same organisation, all pulling in the same direction. If we get tied up with organisation boundaries, place boundaries, ICS system boundaries, national boundaries, then actually we're all going to really struggle. You kind of mentioned some of the organisational changes that are coming, John. They're going to have a big impact. But some of the best ways of overcoming those is by the people who are on this call, or or people who are kind of in those digital leadership roles. If we come together and support each other and address and fill the gaps where those gaps appear proactively rather than reactively, then actually we've got a chance of being able to make some really good changes. Whilst we continue to get stuck in, well, this blueprint says this blueprint says that, this plan says this, and those don't all naturally flow together. Why we say this finance has to pay for this finance pays for that, then we're always gonna struggle. So yeah, smash silos. I think that should be the mantra for the day. We should be one team, and if we're not one team, I think we're going to really struggle in order to deliver some of the change, John.
John, with slogans like that, I mean, sloganeering like that, you should be writing the plan, smash the silos smashing by default.
Yeah. So let's just thank Vincent for that. So thank you, Vincent.
James, you're next.
Yeah, I was smiling because I read one of my former colleagues in a LinkedIn post about the normal behaviour, which I've probably been part of, is there'll be a spreadsheet doing the rounds with a list of commitments. There'll be assigning owners, putting dates against them, starting projects, starting to build business cases, and I think he was advocating for maybe a different approach. So I would, given the amount of commitments, I would take a step back and try, and it is difficult, try and get an enterprise architecture view of the outcomes that we are trying to achieve. So take some time to finish the work on Sonia's work on Let's Talk Architecture, and let's see the high level picture of how this is all going to fit together before setting 1,000 flowers to bloom. I would try and make the mistake of the digital team focusing on the digital objectives. I would try and make sure that the digital capability is embedded in all parts of the implementation arm. We do suffer from, and this goes back to architecture, we do suffer from delivering digital programs, but then getting bits of funding dangled around the latest pathology initiative or the latest outpatient initiative. I would try and get some sort of coherence across all the digital asks across the whole plan, and make sure it tries to align. I would think about the levers and incentives and funding flows. So how should funding flow? What's going to be the best incentives to deliver the plan? I would think long and hard about that. There are going to be lots of need for business cases and governance and treasury approvals. Start managing expectations, but I would also try and get some early funding flowing to experiment and focus on, as some have said, take maybe a small service orientated approach and think about some key outcomes that you want to start delivering on and build some momentum.
Thanks, James. I'm just going to move along because I want to get to everyone. Hayley.
So I was really encouraged by the process by which we got to the NHS plan and the consultation. So I was going to say more practically is actually, why don't we have that, reenact that conversation for the deliverables? So actually, let's get the experts of our community together to actually look at what the ambition is and how we get there. I love the idea of that kind of Let's Talk Architecture, because that's fundamentally how it's all going to fit together. And just in terms of breaking down silos, we've got quite a good set up in the Midlands, the EMAP Acute Providers Network and our Digital Design Collaborative. So I feel like we're a little bit, even maybe a little bit ahead of the curve in terms of looking at this stuff across the, not even just a region, we go way beyond the region, and James and team have been a party to some of that as well. So I think, again, just starting to have those conversations in our neighbourhoods and beyond, and to see what we can bring in. And while every area does have their individual needs, patients are patients, and quite often we can standardise things.
Thanks, Hayley. Penny.
I will add a different perspective here. I mean, I think that something that we need to strengthen is prevention. We talk about having healthier populations, and actually, yes, okay, the obesity drugs are one way forward, but not the single way forward. And we are still crippled with chronic illness as a result of alcohol use, of other kinds of public health measures that should also be taken to achieve a healthier population. And I guess everything that everybody said, breaking silos, good leadership, looking at pathways, looking at the final outcome that we want to achieve, which is a healthier population with better access to care when they need.
Thanks, Penny. And Ben.
There's a whole series of webinars that have just come into my head from all the points that people have said. It's huge, isn't it? You know, it's complex by its very nature. But I think for me, if you strip it all back, again, it's around carrying forward that ambition. I think it is about thinking big. Transformation should exactly be that. And things should look very, very different to when we started. You know, earlier points, basically it's about starting with the end in mind. What is it that we're wanting to change? What does that change look like? And then working backwards from there. We can absolutely think big, but if we break it down, project plan it, then we can take the steps towards that. And it's all the points that have been covered today. It's around people, it's around workforce, it's training, it's AI, it's governance. It's the entire thing. But if you get the right people in the room, strip it all out, have that clarity, get a nice plan, then I think absolutely this can be achieved. There's some potential risks around all of it, but I think for me it's a case of thinking big, but we absolutely need to do things differently. And Hayley, it's exactly like what you're doing. You know, I'm not aware of that model anywhere else, and fundamentally it's working really, really well. So it can be done. It absolutely can be done.
Thanks, Ben. I'm just going to draw in one more kind of comment that's coming from the audience. This is from Christine Roberts, Birmingham Community. Perhaps some sort of roadmap would be helpful to show the sort of short steps needed, which will help lead to the success of the 10-year plan in 10 years. And that's got a lot of likes. As I said, there's been a lot of kind of speculation about why the implementation chapter of the plan was missing. And I think it really huge role, hopefully, for kind of digital leaders within this community and others to really kind of begin to kind of translate the aspirations of the plan into more deliverable kind of strategies. This is unquestionably going to be a conversation which is center stage at summer schools next week, next Thursday and Friday. I know everyone on the panel is going to be there. And I think we've got 320 people kind of registered, which is fantastic. If anyone's been wavering and thinking about it, I believe registration closes in the next couple of days. So still a few tickets available. It's a huge topic, guys. There's been massive interest today. We barely touched on AI. We could certainly do a whole series just on AI. We've had calls.
Let's do one, John.
We've had calls in chat for focus on the research and innovation benefits side. There's a lot in the plan. I did the initial read last week, and I've only just started to go back to it and read a bit more kind of carefully. I think no one in the space would do anything other than welcome digital ambitions being so central, but it's delivery which is going to be the key here, folks. And this is a marathon, not a sprint. So we look forward to welcoming you all back to really begin to kind of further unpack this in the weeks, months and years to follow. Been a huge interest in today's webinar. Thanks everyone for joining. I'd like to ask everyone to thank our panelists for offering such interesting insights. I'm afraid that we are out of time. So it's been a pleasure to be back in the chair. It's been a little while since I last sat here. Great to have you join. Thanks for today's contributions. And that concludes today's webinar. Thanks, everyone.